I don't think this is a right question to ask just a doctor. It is true for any profession for that matter. You're talking about marriage not being successful. Do you know we often think that the money brings harmony in relationship? That's not true. Let me share a very interesting study, एक Howard से study आई थी कि if two people are independent financially and at a good status, paradoxically, it makes separation easier because no one wants to be in the distressed relationship and they find that it's easier to get separated and live their lives independently. We are lucky that in India, if you talk about doctors, the divorce rate is just 1 to 2%. Maybe they're not genuine figures, but Western figures are as high as 22% because dual doctor marriages often requires a lot of understanding between the two partners. Both of them have a stressful job. Both of them have to work long hours. Both of them need to work with the colleagues, with the team members who probably spend more time than you spend with your wife or your near and dear ones. But we need to divide the roles. It's the quality time. It's not just the money equaling to the harmony in the relationships. If one of the partner is a doctor and second partner is not doctor, their marriages works better. And some people think that dual doctor marriages become more successful just because they understand the long working hours, the stress at work better. You know, if one of the person is a doctor and the other person is not a doctor, then often the other person feels that they are second as far as the relationship is concerned. They don't understand that doctors do not have any duty hours. They can be called in the middle of the night for an emergency. They have to work very closely with the people whom the society may think, well, they are working with the people of the opposite sex, hence it can cause a marital disharmony or a discord. End of the day, irrespective of the profession, in any relationship, we need to have a work-life balance and a quality time. Another very important study in medicine, whenever we have to look for a good article, we search an engine called PubMed. The PubMed study has shown it's not just the long working hours which is statistically significant in a disharmony in a relationship, but it is the quality of time they spend with each other. It's not, you may be able to spend a good quality of time even if it is little. Of course, it is easier said than done. If you have a problem at home, it has been proven beyond doubt that your focus at work is also out. I think your problem does extrapolate into a care for the patient which is substandard, which is less empathetic, with less compassion. So it is very important not only to be healthy physically, but also have a stable, healthy mind at home. So I think the youngest generation of doctors would be Gen Zs or Gen Z, which is from 1997 to 2012. Yes, some of them would be doctors. And I'm typically from Gen X, which is 1965 to 1980. There is a lot of difference. I think the exposure is different. We were taught to respect our seniors blindly. We could never argue with our teachers. I'm not saying that the current generation is not good, but the way they have been brought up, the way they have been taught, the way they know everything is fast forward in life. It took me, the last exam I gave was at the age of 40 years. Even I was studying and my son was also taking the exam for year 8. Whereas nowadays, people have fast track training. There are simulators, AI, computers, robotics, and it's much easier for this generation to adopt this compared to my generation. Unless you are forward thinking, unless you have a desire to keep learning new things. And in a medicine, I would hardly remember days when I have not read anything. Even if it is for 15 minutes, I have to go home and update a little bit about what's going on in my specialty, which is trending, which is beneficial to my fellow human beings for the treatment. In my generation, I would just share that I had a TED talk and it was Courage to Teach. My seniors told me that their teacher would reduce a fracture with a cloth on the hand so that no one can learn. Don't you think it's a waste of a skill? Because they were so insecure. And this insecurity in medicine is still there. Because if my junior becomes as good as me, I will feel I'm replaceable, especially in this corporate world. But we are here to set a legacy. Imagine a surgeon with the skill dies without passing it on to others. One day, I may need a particular procedure. And I still remember teaching my junior colleague a step which would make my heart go faster. And he performed it seamlessly well. So well that there was a mixed feeling. मुझे डर भी था कि ये मुझसे अच्छा कर रहा है और एक तरफ से मुझे गर्व भी था कि मैंने इसको सिखाया और ये इतना अच्छा कर रहा है। और ऐसे में आपको चूज करना है, इट इज योर माइंडसेट कि आपको डर को चूज करना है कि उस गर्व को चूज करना है कि आपका जूनियर अपना बेस्ट वर्जन निकल के आया है एंड यू आर सो हैप्पी कि यू हैव trained a fellow human being, a skill which is going to last him lifelong with him. ये आपने बहुत ही मुश्किल सा सवाल पूछा है कि डॉक्टर को चूज करने के लिए हमें ये देखना चाहिए कि वो नॉलेजेबल ज्यादा है कि एक्सपीरियंस ज्यादा है। देखिए, मैं थोड़ा सा ओल्ड स्कूल से हूँ। डेफिनेटली मैं बिलीव करता हूँ कि नॉलेज के बिना तो मेडिसिन में कुछ हो ही नहीं सकता। This is not something that you don't know anything and you just keep seeing patients. That evidence-based medicine will never fit into your treatment. So knowledge is crucial. But with the experience, what my eyes can see, probably a different guy can miss it. Not because he doesn't know it, because eyes and my mind will remember what I've experienced. So it's a combination. I'm not trying to be judgmental. Knowledge is the key, but experience does matter a lot. Especially when you are stuck in a difficult situation. It's like a Arjun ka chakra. So experienced person would know not only how to get into it, but also how to come out of it safely. देखिए, मुश्किल तो बहुत है। अगर आप एक बड़ी सर्जरी कर रहे हैं और आपका जूनियर जिसको आपने ही ट्रेन किया है और आपको बोलता है कि सर ये आप ठीक नहीं कर रहे हैं। एक्सेप्टेंस, एक्नॉलेजमेंट खराब तो लगती है, लेकिन जब हम ये सोचते हैं ना कि दिस इज फॉर द बेनिफिट ऑफ द पेशेंट, इट ब्लॉट्स आउट एवरीथिंग, बिकॉज वी आर टॉट patient first. It is an essential principle of medicine, beneficence and non-maleficence. मतलब कि always act in the best interest of the patient, and second is do no harm. जूनियर डॉक्टर तो क्या, अगर एक जूनियर स्टाफ नर्स भी मुझे कह दे कि ये ठीक नहीं है तो मुझे सुनना पड़ेगा, बिकॉज इट्स अ टीम वर्क। हम ही हम हैं तो क्या हम हैं, बिना टीम वर्क के तो कुछ हो ही नहीं सकता है। सो आई होप दिस आंसर्स कि एज अ सीनियर सर्जन ऑल्सो यू हैव टू लिसन टू ईच एंड एवरी टीम मेंबर, क्योंकि सबका रोल अलग है। जो वो कर सकता है शायद मैं नहीं कर सकता। जो चेकलिस्ट वो हर रोज देखता है, जो उसकी आंखें देखती है, एक ट्रेन नर्स ने ही मुझे सिखाया कि डॉक्टर आपके पास 10 मरीज हैं पर इसको जरूर देख लेना क्योंकि ये ठीक नहीं लग रहा है, बिकॉज वो उसको सुबह से देख रही है। सो हम इग्नोर नहीं कर सकते हैं, हमें मेडिसिन में सबको साथ लेके चलना है, बिकॉज मेडिसिन इज नथिंग बट ability to work in the teams so that your patient is the main prime concern. Say you talked about nepotism. अगर किसी प्रोफेशन में नेपोटिज्म सबसे कम आ सकती है ना, तो मेडिकल प्रोफेशन ही है। उसका रीजन ये है, एंट्रेंस is totally independent, selection criteria is totally independent, everything is centralized। और अगर आप किसी को बना के ले भी आते हैं, मान लीजिए मैं अपना बेटा है वो डॉक्टर है, उसको बना के ले आता हूं, तो उसके स्किल्स अच्छे हों इसका तो कोई गारंटी नहीं है ना। मेरे एक बहुत अच्छे टीचर थे, वो काफी लोगों को पास कर देते थे। मैं अपनी ऑर्थोपेडिक स्पेशलाइजेशन की बात कर रहा हूं, तो उनको किसी ने पूछा कि सर इसको तो बहुत कम आता है, इसको आपने क्यों पास किया? तो बोले कि मेरे पास होने से क्या होगा, ये पब्लिक ही फेल कर देगी इसको, अगर ये अच्छा नहीं है तो पब्लिक ही फेल कर देगी इसको। सो मुझे लगता है कि नेपोटिज्म कैन प्रोबेबली गेट यू वन जॉब, बट हाउ यू परफॉर्म देयर इज टोटली ऑन योर ट्रेनिंग, ऑन योर स्किल्स, योर कंपैशन, योर एबिलिटी टू वर्क इन द टीम्स, योर एम्पैथी and the type of training you have undergone. So how can okay, let's say ki my child comes into orthopedic profession and he's not good. Am I putting the lives of patient at risk? Number one, you can't just become a doctor, go and operate. There is an extensive training. There is a case-based or a procedure-based assessment at every step. Unless that assessment criteria is not fulfilled, the NMC, the National Medical Council, does not allow you to practice independently. डॉक्टर की प्रैक्टिस जो है ना, करते करते 40 से 42 साल लग जाते हैं। जैसे मैंने आपको कहा कि मैं 40 इयर्स पे भी इम्तिहान दे रहा था, उसके बाद फेलोशिप करो, फेलोशिप के बाद आप जॉब देखो, और आपको काम तो सारा आता है पर पेशेंट ही नहीं आपके पास है, क्योंकि आप पॉपुलर ही नहीं है। 10 साल लगते हैं इस प्रोसेस में। अक्सर लोग पूछते हैं ना कि डॉक्टर साहब आपकी फीस बहुत ज्यादा है। जब मैं 40 इयर्स पे थोड़े से पैसे कमा रहा था, तो मेरे जो कलीग्स थे ना, वो कंपनीज के डायरेक्टर बन चुके थे, वो सीईओज बन चुके थे। आई थिंक आई हैव वेरी लिमिटेड ईयर्स टू वर्क। मेरी हेल्थ भी है, हो सकता है mentally, physically, I'm not able to work, which is safe. But ये जो डॉक्टर पैसे ज्यादा ले रहा है और देखते ही बता देता है इस पेशेंट को ये प्रॉब्लम है, have you ever realized that he has spent 30 years to reach a stage where he can pick your diagnosis and write appropriate investigation within 15 minutes of your consultation? He doesn't write any extra tests. He doesn't need so much of a time because he's experienced. So ये जो wrong taboo लोगों ने लगाया हुआ है कि बहुत ज्यादा तनख्वाह ले रहा है, बहुत ज्यादा फीस है डॉक्टर की। आई थिंक एक लॉयर चार्ज करता है अपनी फीस अपने स्किल्स के हिसाब से, तो डॉक्टर को क्यों नहीं हक है कि वो अपने स्किल्स के हिसाब से चार्ज करे? उसकी भी ट्रेनिंग, उसने जो कॉम्पिटेंसीज हासिल करी हैं, दैट्स द ओनली वे। बट फिर भी हमारा ही एक ऐसा प्रोफेशन है, हम किसी पेशेंट को एट दैट पॉइंट ऑफ टाइम ये बोल देते हैं नो फीस टू बी चार्ज्ड, फ्री ऑफ कॉस्ट, अगर हमें लगता है गरीब है। तो मुझे लगता है कि ये जो भगवान ने हमें मौका दिया है ना सेवा करने का, जिसमें एनी टाइम वी कैन राइट नो कंसल्टेशन टू बी चार्ज्ड, और किसी को नहीं है। ये सिर्फ हमारे पास